Good morning, all. I am Dr. Lavesh Agarwal, Associate Professor, Department of Orthopedic in Index Medical College. Today, I am discussing with basic of arthroplasty. So, main content is arthroplasty. We are discussing in introduction, indication, contraindication, type of arthroplasty, prosthesis, bone cement in arthroplasty, operated approaches, complications, physiotherapy management, and last but not least, prevention. So, I am discussing in uh, proper manner, one to one point. So, let me clear next slide. First is introduction. So, orthoplasty. Orthoplasty is an operative treatment of orthopedic disorder, right? Arthroplasty means there is a artificial joints which replaced by any other deformed joint. Means like THR, total hip replacement, artificial hip replacement. So artificial joint replaced by in deformity of AVN, avascular necrosis of hip, arthritic hip, any other deformed hip. So second one is orthoplasty is an operation for reconstruction of a new movable joint. Indication. Arthroplasty, which may use in several indications like severe osteoarthritis of hip or knee joint. Severe osteoarthritis of hip means arthritic hip, which may replace by a total hip replacement means orthoplasty, right? And very common in Asian people are osteoarthritis of knee joint, which may replace by a TKR procedure or arthroplasty, means total knee replacement. Total knee replacement is a procedure in which osteoarthritic knee replaced by a artificial joint, new movable joint, right? So advanced rheumatoid arthritis with disabling pain is a second indication. Quiescent destructive tubercular arthritis, again it's indication for orthoplasty. So many causes are an indication for arthroplasty. Ununited femoral neck fracture is a most common indication for arthroplasty. Correction of certain type of deformity, especially hallux valgus, and most commonly found in Asian or Indian people are avascular necrosis of joint, especially a hip joint. So you can say there is a several indication for orthoplasty, means most common is severe osteoarthritis, avascular necrosis, advanced rheumatoid arthritis, ununited femoral neck fracture, and other deformities. You can see in this picture there is a normal joint in a left side and right side joint affected by osteoarthritis. So bone spur osteophytes, thin cartilage and cartilage fragment. Other indications are bone tumor, hip dysplasia, instability of hip joint, joint stiffness, acetabular dysplasia, frozen shoulder, and loose shoulder. Failure of conservative management or joint constructive procedure. Contraindication of arthroplasty. Absolute contraindication in any arthroplasty or any orthopedic procedure, especially for a replacement. Active joint infection. If a patient ESR is very high, CRP is positive, there is chance of active joint infection or pus discharge and any clinical features or blood parameters which indicate looks like a active joint infection. This is the most absolute contraindication for orthoplasty. Second one, there is a septic joint or sepsis or systemic infection. Again, related to a infection, there is a chronic osteomyelitis, again neuropathic of hip joint and severe paralysis of muscles surrounding the joint. If there is a muscle paralysis of any joint, so there is no use of orthoplasty. This was a definite contraindication, and this is the relative contraindication. Relative contraindication means localized infection such as a bladder or skin infection. Skin condition is not good. Particular operative field means, for example, as we decided for a total knee replacement, yeah, total knee orthoplasty. So skin condition should be a very clear in particular knee joint. In a same manner, if we are doing a plan for total hip orthoplasty, so we should first check the skin condition about the greater trochanter region, gluteal region. Second one is insufficient function of gluteus medius muscles. Again, there is a low grade power of muscles, so no use of orthoplasty. Third one is progressive neurological disorder. And fourth one is insufficient femoral or acetabular bone stock associated with progressive disease. These are the relative contraindications. Type of arthroplasty. Orthoplasty, it may have two types. First one is replacement orthoplasty, and second is excision orthoplasty. So, replacement orthoplasty is the reconstruction of the joint by replacing the joint partially or totally. It can be hemi-arthroplasty or hemi-replacement. And second one is total joint replacement. In this type, only one of the articular surface is removed and is replaced by a prosthesis of similar type. Means uh, in old fracture or neck femur and other comminuted subtrochanteric femur, we replace this structure by bipolar or AMP. So that is called as hemi replacement. We don't touch the acetabulum part. So we touch only a articular surface is one side, means head side. So head is replaced by the AMP, Austin mode processes, and bipolar. It may be a two-type bipolar and cemented or non-cemented. That is other point. But it replaced by a prosthesis of a similar type. That is called as hemi replacement. Second one is total joint replacement. So as this name is total joint placement, in this die, both of the opposed articulating surface are removed. Both articular surface are removed and replaced by the prosthesis compound. Means, example, if there is a total hip replacement, so acetabulum cartilage and head cartilage, both articular surface are removed and replaced by a both component acetabulum and head. So this is called as a total joint replacement, right? As seen in this picture, right side hemi-arthroplasty of hip means articular surface of acetabulum is untouched and head is replaced by a prosthesis. So this is called as hemi-arthroplasty. And if you look into a left side, there is a acetabular cell also present. So acetabular cell and head is replaced by a prosthesis. So that is called as a total hip replacement. So this is the basic difference between the hemi-arthroplasty and total orthoplasty. So first is or surface orthoplasty and second is excision orthoplasty. Excision orthoplasty means in this type, one or both of the articular end are excised so that a gap is created between this gap filled with fibrous tissue. So that is known as excision orthoplasty. Now we come into a prosthesis in orthoplasty. Prosthesis in orthoplasty, it may be a several type. Joint replacement is a procedure whereby one or both the component forming a joint are replaced with artificial component is called as prosthesis. And prostheses are made up of special metal alloy and high speed density polythene. Two type prostheses are used: Austin Moore prosthesis and Thompson prosthesis. Austin Moore is very common in old era. Austin Moore was gold standard for a neck femur and Thompson process. They are commonly used in hip joint. Bone cement. Bone cement is a methyl methacrylate compound. Cement can be used with or without in hip joint. It can be a two type. Cemented hip. In the cemented hip, the acetabular as well as femoral component are fixed with the help of bone cement. You can see in this picture, there is a femoral shaft. Implant is set in a canal with the help of cement. So blue color denote the metal, white color denote the cement, and you can see very well both is present. So when you see the femur canal, if there is a osteoporotic bone, there is always held with bone cement. Cemented hip orthoplasty used in elderly patients with expected life of 10 to 15 years. As the stability of prosthesis is achieved within 15 minutes of surgery. Non-cemented hip is a recent development in which bone cement is not used to fix the component of hip joint. Non-cemented hip is used in younger people. You can see total hip replacement. There is a component of acetabular component, plastic liner, femoral head. So this is total hip replacement. Objective. Introduction, history, principle and consideration, indication, contraindication, implant, and technique. Introduction. Hip replacement is also known for arthroplasty. Orthoplasty is a reconstructive surgery to restore the joint motion and function to relieve pain. It generally involves the replacement of bony joint surface by a prosthesis. It is the most common orthopedic surgery. Hip replacement surgery can be performed total replacement or hemi replacement. It consists of replacing both the acetabulum and femoral head and general. Principle and consideration. The prosthesis implant must be durable. They must permit extraordinary low friction movement at the articulations. They must be firmly fixed to skeleton. They must be insert and not provoke any unwanted reactions in the tissue. The prostheses are of various design, may be fixed to remaining bony by cement, press fit, or bone ingrowth. Selection of prosthesis and fixation technique depend on the patient's bone structures, joint stability, and other individual characteristics, including age, weight, and activity level. Arthroplasty is an exciting and meticulous procedure to reduce the risk of an infected prosthesis. Special precautions are carried out in OT operations theaters to reduce particulate matter and bacterial count of air. Because joint replacement is a surgery, orthoplasty is a surgery in which we can try to reduce the rate of infection as much as possible to clean the OT with the help of antibiotic, with the help of all blood parameters which are normal, should be checked before surgery, ESR, CRP of every patient, and blood count should be within normal limit, and OT should be clean, fumigate. Everything should be a minimum risk. So joint replacement can be done at minimum risk of infection, because infection is a major issue in orthoplasty surgery. Indications for patient with severe osteoarthritis, rheumatoid arthritis, selected fractures, congenital hip disease, joint disability, contraindications we already discussed. Implant. The prosthesis implant used in hip replacement consists of different parts: acetabular cup, femoral component, articular interference. Often correct selection of prosthesis is important. Type of fixation, as we already discussed: cemented fixation, uncemented fixation. Type of implant, it may vary: metal, like THR, ceramic, metal on metal, ceramic, or cemented or uncemented. Technique. There are several incisions defined by their relation to gluteus medius. The approaches are posterior, mural, lateral, Adams, anterolateral, Watson Jones, and anterior. So basically, it is anterior, posterior, anterolateral, or lateral, right? So posterior approach assess the joint and capsule through the back, taking piriformis muscles and soft external rotators of the femur. Lateral approach is also commonly used for replacement. The approach requires elevation of hip abductor gluteus medius to assess the joint. Anterolateral, the anterolateral approach develop the internal between the TFL, tensor fasciolatum, and gluteus medius. So Watson Jones is a anterolateral and anterior. The anterior approach uses an interval between the sertorius muscles and TFL. Greater trochanter osteotomy and minimal invasive approach, MIS. There is no compelling evidence in literature for any particular approach, but consists of professional opinion favor either modified anterolateral or posterior approach. Pre-operative management. Infection are ruled out. Pre-operative technique is provided. Post-operative regimen that will be carried out after surgery is explained. Atrophic muscles must be re-educated. Isometric exercise of quadriceps and gluteal muscles are taught where to wheelchair transfer without going beyond the hip flexion limit 60 to 90 is taught. Non-bed bearing, partial bed bearing ambulation with ambulatory aid is taught to facilitate post-operative ambulation. Abduction, splint, knee immobilizer, or continue fascia motion is demonstrated. Anti-embolism stockings are applied to minimize development of thrombophlebitis. Skin preparation include antimicrobial solutions to reduce the skin microorganism. Antibiotics are administered as prescribed to ensure hepatic blood level during and immediately after surgery. Cardiovascular, respiratory, renal, hepatic functions are assessed and measures are taken to maximize general health conditions. Review discharge and rehab option post surgery. Post operative management. Use of appropriate positions to prevent dislocation of prosthesis and facilitate healing. Numerous modifications are required in position the patient postoperatively. After hip arthroplasty, patient is usually positioned supine in a bed. Second one, most important, the affected extremity is held in slight abduction where either abduction splint pillow to prevent dislocation of prosthesis. Avoid acute flexion of hip. The patient must not adduct or flex the operated hip, may lead to subluxation or dislocation of the hip. To nurse, turn patient on unoperated while supported operative hip securely in a abduction position. The entire length of leg is supported by the pillow. Use a pillow to keep the leg abducted. Pillow placed at back for comfort. The use of overhead trapeze to assess the position change. The bed is not usually elevated more than 45 degrees, placing the patient in an upright sitting position, but a strain on a hip joint may cause dislocation. A fracture bed plan is used. Instruct patient to flex the unoperated hip and knee. Pull up the trapezius to lift buttock and to palm. Instruct patient not to bear down on operated hip in flexion when getting off the palm. Lateral complications provide aggressive care and continuous assessment. Prevent thromboembolism by continuous use of plastic ointment while patient is in a bed. Discontinue SCD when patient is ambulatory. promoting early mobilization. Within 1 day after surgery, short period of standing may be ordered. Monitor orthostatic hypotension. Weight bearing may be limited with ingrowth processes to prevent disruption of the bone growth. Transfer to the chair or ambulation with aids such as a walker are encouraged as tolerated and based on the patient conditions and type of surgery. Health education. Encourage patient to continue wear elastic stockings after discharge until full activities are resumed. We should encourage the patient to continue the wear elastic stockings for prevent DVT, deep vein thrombosis, which is a complication in orthoplastic surgery. Ensure the patient avoid excessive hip adduction, flexion, and rotation for 6 weeks after hip orthoplasty. Avoid excessive hip adduction, flexion, and rotation for a 6 week. Avoid sitting low chair or toilet seat to avoid flexion hip more than 90 degree. Keep knee apart. Do not cross leg. Limit sitting to 30 minutes at the time to minimize hip flexion and the risk of prosthetic dislocation to prevent hip stiffness and flexion contractures. Avoid internal rotation of hip. Follow weight bearing resection from the surgeon. Encourage quadriceps setting and range of motion exercise as directed. Have a daily program of stretching, exercise, and rest throughout lifetime. Do not participate in any activity placing undue or sudden stress on them. Use a cane when taking fairly long step. Suggest self help and energy saving device. Advise patient to keep with two pillow between the legs to prevent turning over in sleep. Tell patient to lie down when able twice daily for 30 minutes to promote full extension of hip. Monitor for late complication. As we know, there is a chances of deep infections, increased pain, or decreased functions, implant wear, dislocation, avascular necrosis, and teach patient use of supported equipment, crutches, crane as prescribed. Avoid MRI studies because of implanted metal component. And most common advise patient that metal component in hip may set off metal detector. Airports, some buildings, they should carry a medical identification card. In practical life, most of the patient are suffering from this situations at most commonly airport, shopping malls, when they were traveling or shopping. So they mostly stopped by uh, security just because of metal, which detect in a metal detector. So always keep the ready medical certificates when patient ready to discharge to avoid such embarrassing situations. Exercise guide for hip replacement. We always advise to people regular exercise to restore your normal hip motions and strengthening as a gradual return to everyday activity are important for your full recovery. Orthopedic surgeon and physical therapist may recommend it as an exercise for a 20 to 30 minutes at least 2 to 3 times a day during your early recovery, because as we know, if there is a muscle weakness, so there is no use of orthoplasty. If we are doing a orthoplasty, we are doing like a total hip or total knee. If we are doing any procedure, any operative procedure, so we suppose muscle power goes to -1. If suppose there is a muscle power is 4 or 5, when we are doing a quadriceps plasty or any surgical procedure around the knee or hip, so we find the muscle power goes into a 3 or 2. So it's very advisable to power the muscle or strengthen the muscles to patient to educate about the muscle program or rehab program, or you conduct there is a physiotherapy session, right? So they may suggest some of the following exercise. The first and very simple exercise, usually routinely I advise to my patient, there is a ankle pump, which is slowly push your foot up and down, which is very simple, but it's very much required for your muscle power. So first, you should educate your patient about your ankle pump. Patient can do itself on without any help. So this is very useful for your arthroplasty, like ankle pump slowly push your foot up and down. You just ask your patient or their relatives. This exercise can do several times as often as every 5 to 10 minutes. This exercise can begin immediately after surgery and continue till you are fully recovered. Second one is ankle rotation. Move your ankle inward toward your other foot and then outward away from your other foot. This is very important exercise, and this is basically beneficial to your muscle strengthening without any help of assistant or physiotherapist. So you can say or you can guide your patient. This exercise repeat 5 to 10 times in each directions, 3 to 4 times a day. Next, be supported knee bendings. Slide your knee toward your buttock, bending your knee and keeping your heel on the bed. Do not let your knee roll inward. Repeat same in a manner 8 to 10 times, 3 to 4 times a day. And again, some exercise protocols should be followed, like buttock contractions, tightening buttocks muscles and hold up to the 5. Repeat 10 times, same in a manner. Abductions exercise, quadriceps exercise, So there is very clear instruction about your patient, especially in a arthroplasty patient, especially in a hip or knee patients. When you do a surgery, you should follow very strictly your rehab program. You should educate your patient and their relatives to your rehab program, like abduction exercise, quadriceps exercise, ankle movement, ankle exercise, ankle rotations. All our exercise are very grateful for your patient recovery. So in short, we just finished this topic with summarize in a good manner. Orthoplasty in a introduction, implant choice, prosthesis, type of orthoplasty like hemi-orthoplasty, total orthoplasty. Then you can say just in a operative protocol, approaches like a hip, anterior, posterior, anterolateral, and then come to a rehab protocol. So you should go with a protocol manner, introduction, classifications, indications, contraindications, then operative procedures, approaches, then complications, and last but not least, there is rehab protocol. So this was my topic. Thank you so much. Thank you so much.